Imagine a silent invasion. A disease so potent it can decimate entire herds, cripple livelihoods, and leave a trail of economic devastation in its wake. This isn't a scene from a dystopian film, it's a stark reality unfolding across our planet. We're talking about lumpy skin disease. Welcome back to VetHelp, the channel where compassion meets science. Today we're tackling a critical issue that every animal owner needs to understand. We're going to break down the science, cut through the confusion, and give you the clear, actionable information you need to protect the animals in your care. Let's get started. If you care about animal health, if you're connected to agriculture, or if you simply believe in the well-being of our creatures, what you're about to learn is not just important, it's crucial. Stay with us, because the truth about this enigmatic virus might just surprise you and empower you to become part of the solution. For centuries, lumpy skin disease, or LSD, was largely confined to Africa. A regional problem, devastating, yes, but contained. But then, something shifted. Like a creeping shadow, it began its relentless march across continents, jumping borders, defying expectations. From the Middle East to Asia, and now making alarming inroads into new territories, LSD has transformed from a localized threat to a global crisis. The question isn't if it will arrive in a new area, but when, and whether we'll be ready. So, what exactly is this relentless enemy? At its core, lumpy skin disease is caused by a capraypox virus, a relative of the smallpox virus that once plagued humans. It's a DNA virus, robust and cunning, and it primarily targets cattle. Think of it as a master of disguise, entering an animal's system and unleashing a cascade of debilitating symptoms. But how does it do that? And why is it so incredibly hard to stop? The name says it all. Lumpy skin disease. The most striking symptom, and indeed the diagnostic hallmark, are the characteristic firm, raised nodules, or lumps, that appear all over the animal's skin. These aren't just cosmetic. They're incredibly painful and can range from a few millimeters to several centimeters in diameter. But the suffering doesn't stop there. We see fever, reduced milk production, sometimes a complete cessation, weight loss, swollen lymph nodes, lameness, and even lesions in the mouth and respiratory tract. In severe cases, these lumps can ulcerate, becoming sites for secondary bacterial infections, leading to horrific complications and, tragically, death. Cliffhanger, Chapter 1. What makes these visible horrors even more insidious is the way this virus spreads. A silent courier moving through herds, often unseen until it's too late. How does this nightmare spread? LSD is primarily transmitted by blood-feeding insects, mosquitoes, flies, and ticks. They act as unwitting biological syringes, picking up the virus from an infected animal and injecting it into a healthy one. Think of it like a silent air force, deploying viral pathogens from farm to farm, sometimes over significant distances. Direct contact between animals, contaminated feed, water, and even shared needles can also play a role, but the insect vectors are the primary culprits in its rapid spread. It's a multi-pronged assault, making containment a monumental challenge. So, we've got a virus that causes unsightly lumps, spreads via flying assassins, and makes cattle miserable. Sounds bad, right? Well, it gets worse. Economically, LSD is a wrecking ball. The loss of milk production, reduced weight gain, damaged hides, making them worthless for leather. Infertility, abortions, and of course, the mortality rates, all converge to create staggering financial losses for farmers and entire agricultural sectors. It can plunge families into poverty and destabilize regional economies. Question: what if I told you that despite these dire consequences, there's still hope for effective intervention and even prevention? Before we can treat it, we have to identify it. Diagnosis of LSD usually begins with the distinct clinical signs, those unmistakable skin nodules. However, confirmation requires laboratory testing, typically using PCR, polymerase chain reaction, to detect the viral DNA in tissue samples, blood, or saliva. ELISA tests can also detect antibodies, indicating exposure. Early and accurate diagnosis is paramount to implementing control measures and preventing further spread. But what happens once it's confirmed? Can we actually cure it? Here's a harsh truth. There is no specific antiviral drug for lumpy skin disease. Let that sink in for a moment. Unlike bacterial infections where antibiotics can be a lifesaver, we don't have a direct weapon against the LSD virus itself. This means treatment is entirely supportive. The goal is to alleviate suffering, prevent secondary infections, and help the animal's own immune system fight off the virus. It's a bit like nursing someone through a severe flu. You manage the symptoms while the body does the heavy lifting. This makes the role of skilled veterinary care and dedicated animal husbandry absolutely critical. So, what does this supportive care actually look like? Let's break down the protocol, because knowing these specifics can make all the difference for an infected animal. Antipyretics and anti-inflammatories. Fever and pain are significant issues. Medications like NSAIDs, non-steroidal anti-inflammatory drugs, such as flunixin, meglumine, or meloxicam, are crucial. Dosage: flunixin, meglumine. Typically 1.1–2.2 mg body weight, administered intramuscularly, IM, or intravenously, IV, once daily for 3 to 5 days, or as directed by a veterinarian. Dosage: meloxicam. Usually 0.5 mg body weight, administered subcutaneously, SC, or intravenously, IV, once daily for up to 3 days, or as prescribed. When to give: at the onset of fever and signs of pain, inflammation, to reduce discomfort and help the animal eat and drink. Antibiotics for secondary bacterial infections. This is where the real danger lies. Those skin lesions and oral ulcers are open invitations for bacteria. Broad-spectrum antibiotics are essential to prevent and treat these secondary infections. Examples: oxytetracycline, long-acting formulation, penicillin-streptomycin combinations, or amoxicillin. Dosage: long-acting oxytetracycline, often 20 mg body weight, administered IM, repeated after 3 to 5 days if necessary, or as per veterinary guidance. Dosage: penicillin-streptomycin. Specific dosages vary, but typically 1 ml per 25 kg body weight, IM, once daily for 3 to 5 days. When to give: immediately, if signs of secondary infection are present, e.g., pus from lesions, severe swelling, worsening lameness beyond what the virus alone would cause. Wound care: the skin lesions require meticulous attention to prevent further infection and promote healing. Topical antiseptics: daily cleaning with dilute povidone iodine or chlorhexidine solutions. Fly repellents: essential to deter insects from laying eggs in open wounds. Topical sprays containing permethrin or cypermethrin can be used. When to apply: regularly, usually once or twice daily, until lesions heal. Nutritional and fluid support: sick animals often refuse to eat and become dehydrated. Electrolyte solutions, oral rehydration solutions are vital. In severe cases, intravenous fluids might be necessary. Nutrient-dense feed: offer palatable, easily digestible feed. When to give: continuously as needed, especially if the animal is not eating or drinking adequately. But the best treatment, of course, is prevention, and that starts with stringent biosecurity measures. This is your first and strongest line of defense: vector control. Since insects are the primary carriers, aggressive fly and mosquito control programs are critical. This includes using insecticides, fly traps, and managing stagnant water sources where mosquitoes breed. Movement control: restricting the movement of animals, especially from affected areas, is paramount. Strict quarantine protocols for any new animals introduced to a herd are non-negotiable. Disinfection: regular cleaning and disinfection of farm premises, equipment, and vehicles with effective virucidal disinfectants can help reduce viral load. Personal hygiene: farm workers should practice strict personal hygiene, including changing clothes and footwear when moving between different animal groups or farms. While biosecurity creates a perimeter, vaccination builds an internal fortress. This is where we truly turn the tide. Live attenuated vaccines, often derived from related capripox viruses like sheeppox or goatpox virus, are highly effective against LSD. They work by introducing a weakened form of the virus, stimulating the animal's immune system to produce protective antibodies without causing the disease itself. Types: homologous, LSD virus-based, and heterologous, sheeppox or goatpox virus-based vaccines are available. The choice depends on regional availability and veterinary recommendation. Dose: typically 1–2 ml per animal, administered subcutaneously. When to give: mass vaccination campaigns are crucial in endemic and at-risk areas. Calves are often vaccinated from 3 to 4 months of age, with boosters as recommended by local veterinary authorities. Regular revaccination is often necessary to maintain herd immunity. Cliffhanger number 2. But even with these powerful tools, why does LSD continue to spread, and what more can be done to protect our invaluable livestock? The fight against lumpy skin disease isn't just a local skirmish, it's a global war that demands international cooperation. Organizations like the OIE, World Organization for Animal Health, and the FAO, Food and Agriculture Organization of the United Nations, are working tirelessly to coordinate research, share information, and facilitate vaccine distribution. But the effectiveness of these efforts hinges on every single individual, every farmer, every government taking responsibility. We cannot afford complacency. This isn't just about cattle, it's about food security, sustainable agriculture, and the welfare of communities. As animal lovers and informed citizens, your role is vital. Vigilance: be aware of the symptoms. If you own or work with cattle, inspect them regularly. Reporting: if you suspect LSD, report it immediately to your local veterinary authorities. Prompt reporting is crucial for containment. Advocacy: support policies and initiatives that promote animal health, vaccination programs, and robust biosecurity. It's less Game of Thrones and more Farm of Peace, but just as epic in its stakes. The scientific community isn't resting. Research continues into more effective and heat-stable vaccines, improved diagnostic tools for rapid field detection, and a deeper understanding of the virus's epidemiology. Genomic sequencing helps track viral strains and predict potential new outbreaks. The future holds promise for even more sophisticated solutions. But these advancements depend on continued investment and collaborative effort. We are in a race against a constantly evolving virus, and every breakthrough counts. So, to recap, lumpy skin disease is a serious, globally spreading viral threat to cattle, causing devastating economic losses and animal suffering. There's no direct cure, making supportive care, stringent biosecurity, and widespread vaccination our most powerful weapons. Every individual, from the large-scale farmer to the backyard hobbyist, has a critical role to play in monitoring, reporting, and implementing preventive measures. By understanding the threat and acting decisively, we can protect our animals, our livelihoods, and our future. The world of animal health is complex, and understanding these diseases is key to protecting our beloved companions and livestock. If you found this deep dive into lumpy skin disease valuable, you'll definitely want to check out our next video. We tackle another formidable foe, canine distemper virus. Click on the end screen now to learn how to safeguard your canine companions from this equally dangerous threat. Our mission at VetHelp is to build a community of informed animal lovers right here in Pakistan and beyond. If you found this video helpful, please hit that like button. It really helps the channel grow.